What is knee osteoarthritis, or OA? Knee OA is a degenerative condition in which the bearing structures of the knee fail. They fail from overload or injury, but they can also fail when the tissues themselves are weak. As time goes on, they progressively wear away. What causes knee OA? Many factors can be involved, and we don't understand all of the interplay of many of these factors. But what we're understanding more and more is that mechanical factors, the forces that the knee is exposed to, are dominant. They are the most important driving factors for the degenerative wear-away process. What is the nature of knee OA? It's a very common problem. It begins in one part of the knee. Often it is silent, and often the progression is slow. It often results in serious disability over time. There are several risk factors. The risk factors for knee OA are quite well known. We know that injury, such as a fracture of the joint or a torn cartilage in the knee, can be an important risk factor for long-term problems. Another risk factor which we now know is involved is the alignment, the shape of the leg. So if your leg is in an abnormal position for either knock knee or bow leg, as you load it, it can put more loading in one side of the knee as compared to another, and over time that can be a factor in the initiation of the process. Not by itself, but it is a risk factor which, in combination with the mechanical and other factors, can be important. We know also that the high pivoting and impact loadings are driving forces for the knee problem of osteoarthritis. We're becoming more and more aware that neurological and metabolic conditions, for instance diabetes, are linked to knee OA. We don't exactly know how that process works, but there's a clear relationship between patients who have metabolic disease problems, lipidemia, and diabetes, and the condition of osteoarthritis. Weak bone and supporting structures can also act as risk factors for knee OA. And inactivity, interestingly enough, although one might think if you don't use your knee much that there isn't a risk, the opposite is true. If you're not active and you don't keep your knee mobile and strong, you are at risk for further problems, likely because the inactivity leads to further weakening of the supporting bone and muscle structures. There's a clear identification of being overweight. Being heavy is a problem, but being overweight is a significant risk factor for knee OA, and the problem, as we'll see further, adds to itself. All of these things are age influenced, so when we're young, these factors may not be much at play, but as we grow older and older, these factors, if they have been involved over time, interact together so that the risk of these factors being present as we age is greater.